Welcome to Inside ProMedica, your path to wellness. Brought to you by ProMedica Charles and Virginia Hickman Hospital, where your health is our mission. Each month, we bring you insights from leading medical experts, the latest advancements in care, and essential health tips to keep you and your family well. Let's get started.
This is Kathy Williams, and with me on tonight's program is Dr. Daniel Marcusa, and he's fairly new cardiologist at the Charles and Virginia Hickman Hospital, ProMedica here in Adrian. Doctor, welcome to the group.
Thank you. It's a pleasure to be here.
You said you'd only been here, 9 months now?
Yeah, I started September 2025.
Okay. So, fresh to the community. How are you finding things so far?
Oh, it's just been great.
Isn't it beautiful?
It's a beautiful area. I love my drive every day.
Yeah.
And the people I get to work with are just some of the most incredible people. I mean, we have the best nurses, the best medical assistants, the best ancillary staff, the best echo techs.
I know a lot of them.
Yeah.
And they are, that's one of the things I do love about having a local hospital is you do get to know the people that work there, and you come to realize that everybody's there to help you. Sometimes you have to just be a little patient.
Well, I think it really is an amazing thing to be able to do a lot for people closer to home.
Yeah.
Because, oftentimes we do need to send people to a bigger place, or when we do, it can be a pretty big strain on the family because you got to drive an hour each way. And so being able to do a lot closer to home, I think it just makes such a difference for people.
Well, I know I can get in and out of the ER here way faster than at U of M. I'm just saying. But your specialty is cardiology, and you're non-invasive cardiology. So explain to our listeners what that means.
So I think that I like to describe myself as kind of a thinking cardiologist. So there are sort of procedural cardiologists who, if you need a stent or you need a pacemaker, you need something else, you need to go to them because my hands just are not good enough to do any of those things. Okay. But I specialize in thinking about patients, talking to patients, getting to know people, and helping come up with the right sort of strategy to help people get better, feel better, live longer, et cetera. And within that, I also have a specialty in imaging. So I read cardiac CTs, and I do advanced imaging for valve disease and other things of that sort. And so I kind of integrate the eyesight, the pictures, the story, and everything else to kind of come up with the right way to make people feel better.
Well, and I think that helps with some of that preliminary testing. Maybe you don't need the next step. Maybe all you need is what you can offer.
Yeah, so what we've been able to do at Hickman Hospitals, we've been able to start doing a lot of transesophageal echoes, which is kind of an advanced imaging test for valve disease and for other problems. And so we've had a lot of people who've been able to not make that hour-long drive somewhere else and get pretty high-quality information closer to home, oftentimes a lot quicker, too.
Right. So I want to talk a little bit about some of the different things that are affected that you do probably deal with on a regular basis. One of them is AFib. Can you explain what that is, what the symptoms could be, and different ways of handling that?
So we see a lot of AFib. It's a really common heart rhythm problem. And so in AFib, the top parts of the heart are beating in a chaotic fashion. And so instead of the regular, lump, dump, lump, dump, lump, dump that you're probably used to hearing, you'll have a very irregular and oftentimes faster heart rhythm. And what's happening is the top parts of the heart have this very chaotic electrical system, so that instead of 1 beat per second, the top parts of the heart want to beat 10 times or 50 times a second. And some of those beats make their way to the bottom chambers. So you can have a faster, irregular heart rhythm. That sometimes causes no symptoms at all. We have many people who have been in AFib for, who knows how long, days, weeks, months, years, and they have no idea. And other people can tell the second their heart flips out of rhythm, where they just feel that irregularity in the chest. Yeah,
almost like you're having a stress attack or something.
Yeah, so people describe it in all sorts of different ways. Sometimes it's a palpitation where I just feel some irregularity. Some people will just feel a little tired or fatigued or dizzy. I mean, it can be a really insidious symptom where you don't really know exactly what it is. You just don't quite feel right.
Something's just going on. I don't know what it is. Yeah. So who is most at risk then of possibly developing AFib?
So almost anybody in the right circumstance can develop AFib. Okay. But it's much more common as you get older, as you develop other medical problems. So if you have high blood pressure, you have sleep problems, all of those can trigger it. Sometimes there are different endocrine problems, like if you have a thyroid abnormality, that can make it more common. Okay. And alcohol use is a big one. So the more alcohol you take, the much more likely you are to have AFib. And conversely, if you have AFib and you stop consuming as much alcohol or cut it out entirely, you can significantly reduce your amount of AFib.
Well, and I even thought I saw something about sleep apnea.
Yeah, sleep apnea is another big one. Yeah. And so sleep apnea, being on the bigger side, extra weight, all of those things are pretty big drivers. And again, on the one hand, they're risk factors, so if you have them, you're more likely to have it. But on the other hand, if you have it and you have those risk factors, if you treat the sleep apnea, if you lose the weight, if you become more physically active, you can dramatically decrease the amount of AFib you experience.
Exactly. So with that, also then you also deal with people that are experiencing heart failure. A scary word, but sometimes easily treatable.
Yeah.
So help us learn a little more about that as well.
Yeah. So heart failure, very, very common. And I think that the term is a really drastic sounding term. And heart failure is a very wide spectrum. So we have some people who are very sick with heart failure. They have a very weakened heart muscle. They're on a lot of different medicines to support heart function. Some people need heart transplants or heart pump devices to keep them going. And that's the very extreme end of the heart failure spectrum.
Right.
Then there are other people who have very modest symptoms. They have a little bit of swelling of the legs, or they have a little shortness of breath when they walk around, and they can't quite do that, 15th flight of stairs, but they can get the first 14 just fine.
Okay.
And that can also be heart failure, but it's on a very mild end of the spectrum. So I find that the term heart failure conveys a lot more worry and oftentimes makes people feel a lot more anxiety about their health,
right,
as opposed to empower people to feel, hey, this is something that explains the symptom I've been having, and here's XYZ treatment options that can make you feel better.
Well, I've even heard people describe it as almost feeling like they have asthma, like they're all of a sudden having trouble breathing and not sure why. It's not allergies.
Yeah. So the core symptoms can be a breathing difficulty or an exercise intolerance.
Okay.
So anytime you used to be able to do something that you no longer can do, it's a good idea to get in touch with somebody who can think through what the different reasons could be. Is it asthma? Is it COPD? Is it heart failure? Is it AFib? Is it something else?
Right.
And so I find people who have dogs are oftentimes that's the canary in the coal mine, because they used to walk that big loop, twice a day, and then maybe I can only do it once a day, and now I get halfway there, and now I don't even want to take the dog out. I have somebody else do it.
Poor thing.
Yeah.
Poor dog.
So poor dog, but also it's really helpful because it tells us, and the last 6 weeks, I no longer can do something that I used to do. Now I need to go figure out why that's the case.
Now, do they start with you then, or do they start with the primary? How do they get in to see you?
Yeah, so there are a lot of different ways to come see me. First of all, just come on by. We're happy to see anybody. Our waits are not actually that long right now. So if you
where
need to see
do they
somebody,
go? Just straight to the hospital?
Yeah, we're in the first floor of the Hickman Hospital.
Okay.
So we're
they
very
don't have
happy
to go through ER.
No. So we have some people that we meet in the emergency room, or we meet in the hospital if you're hospitalized with some problem. So you come in with shortness of breath, you go to the emergency room, and then if they think that you have a heart problem, or they're just wondering whether you might have a heart problem, they'll call me or one of my colleagues, and we'll come by and meet you. Okay. We have other people that go to the primary care doctor or urgent care, and somebody says, well, we're not so sure about the EKG or the blood work or the story, so why don't you go see a heart doctor? And we're very happy to meet you that way.
Okay.
And then I have a couple of people who've decided, you know what, I'm worried enough about my heart, I want to see a heart doctor, and then they come see us. Yeah. We take all comers.
There you go. Well, that's good to know, because sometimes it's hard to get into a specialist. And so, technically you're a specialist.
Yeah, no, we are specialists. And I think one of the things that we can offer is, obviously, we're the experts in cardiovascular care. But oftentimes we also try to be very good general medicine doctors as well.
Okay.
We're not going to order the colonoscopy. We're not going to do a lot of those little things.
Right.
But we can sit back and say, what do we think is really going on with this person who's short of breath or is having a chest discomfort or something else?
Okay.
So at least I try to be very holistic in the way that I think about things and make sure that, maybe you come see me and we say the heart's fine, but we're worried about the lungs, and we'll have you go see a lung specialist or something else.
Okay. Well, and that's good to know, because especially, with this darn AI telling us what's wrong with us medically, it's not always right.
Yeah. I think that, AI is a really important tool, and I think that I find the most productive conversations I have with people are when people are well-informed and have a clear set of worries and a clear set of questions.
Okay.
And if you don't have a clear set of worries and don't have a clear set of questions, that's also fine. We're happy to figure it out together.
Okay.
But when somebody comes in with a list and says, I have XYZ questions and I'm worried about this symptom or this medicine or this diagnosis, then we can be very targeted and provide a lot of information.
Okay. Yeah. So nothing wrong with doing a little research on your own. Just don't totally diagnose yourself.
There you go. I want to schedule the heart surgery without talking to you first.
Exactly. Well, that's really good information, Dr. Marcusa, and I appreciate you coming and talking to us, help our listeners learn a little bit more about what they can expect at ProMedica, Charles and Virginia Hickman Hospital, or Cardiac Department.
Very good. Thanks for having me.
That's it for this edition of Inside ProMedica, your path to wellness. We hope you've gained valuable insight into the exceptional care and services available at ProMedica Charleston, Virginia Hickman Hospital. For more information or to connect with our healthcare team, visit promedica.org/Hickman. Take care, stay well, and join us again on the last Tuesday of each month at 6:20 p.m. for another edition of Inside ProMedica, your path to wellness. You can also listen to these programs as podcasts anytime under the On-Air Audio tab at WLEN.com.